but the thing we find, like the final common endpoint for a lot of this is weight loss. So I can sit there and give somebody a different diet. I can give them a different resistance or aerobic training exercise regimen. But there have been plenty of studies looking at this, and really the most important thing, and when it's controlled for, doesn't seem to actually change, is weight loss.
And when it comes to lifestyle, there's lots of things people can do to improve their erectile function without going to, pumps or pills. Not necessarily that those are bad things, but how do you counsel, let's say, your type 2 diabetic, overweight patient with untreated sleep apnea that comes in talking about ED? What are going to be the biggest levers to pull for a patient like that?
I'm going to send them right to you. You bring up an excellent point. The data is a little bit more murky on this. Obviously, treating undiagnosed comorbidities is important. Getting better glucose control, taking care of someone's sleep apnea, which again, obviously affects all their diurnal cycles, testosterone included in that, is important. But the thing we find, like the final common endpoint for a lot of this is weight loss. So I can sit there and give somebody a different diet. I can give them a different resistance or aerobic training exercise regimen. But there have been plenty of studies looking at this, and really the most important thing, and when it's controlled for, doesn't seem to actually change, is weight loss. So beyond controlling comorbidities, weight loss is what I talk about with a lot of my patients. I do think it's challenging, because you guys have probably seen men that come in and they're not overweight. They're doing what they're supposed to do, and maybe there's, we can change it, add some more resistance activity or something, but I think we're in the margins at that point. So my advice would be treat untreated comorbidities and try to get into the normal weight for your body size.
For patients that perhaps have already lost a significant amount of weight, or maybe they haven't, and they just want suprapubic fat liposuction, I don't know if you've encountered this a lot, or maybe they're post-panniculectomy, which is tummy tuck, but they still have a lot of exogenous folds and whatnot. Are you seeing this trend as well? Because there's certainly a lot of people who are losing a lot of weight.
So we have a surgery that I don't do. One of my partners does, Dr. Brokehammer, called a unburying of the penis surgery, which is something that has become a major result of people losing a bunch of weight, but not having, they have this what's called lipodystrophy, or they have this abnormal deposits of fat that are left behind after these surgical procedures, or even after just, regular weight loss. They've lost 200-300 pounds, and the area above or surrounding their penis still has a lot of fatty tissue. In this procedure, actually, in this buried penis repair, we actually fix that either with liposuction or an escutinectomy, which is removal of that tissue, plus pinning the actual penis back down to the pubic bone. So I've seen a major increase in those cases, because again, you can do your best to lose weight, but sometimes the way your body responds is not in full. So
yep. Sounds like people should probably do that instead of going to a med spa style clinic and getting liposuction just on the suprapubic fat pad.
Yeah, I think that's great advice. And now maybe we shift a little bit. I think we've done a good job of not making you say too many hypotheticals, but now getting into epigenetics, which we were chatting a bit about before we started recording. What are your thoughts on epigenetics and fertility? A lot of people, myself included, would tend to think like, hey, when you are starting to conceive, let's try and do things as naturally as possible. Paper probably 1 or 2 years ago now with metformin taken by the fathers seemed to be correlated with, again, very low, but a little bit of a signal towards, hey, this might cause some issues with sexual development in the male fetuses. So I guess kind of give me your take on epigenetics. Do you think about this in your practice, or is it something where you're seeing cases where you're pulling so many levers it's sort of on the back burner? Just what are your thoughts in general on, is this something people should consider or not?
Yeah, that is a tough question. Realistically speaking, usually by the time someone's gotten to me, being able to have a child is the end game here. I think that it is important to really think about the progeny's health beyond just being able to have one, but there's so much emphasis and effort being put into finding the right sperm and doing the right thing that epigenetics, unfortunately, I wouldn't say just my practice, I think in general, have taken a little bit of a backseat in that regard. But I don't think that makes them any less important. I was listening to a talk at the Society of Male Reproductive Urologists a few years ago. Somebody got up there, started speaking about epigenetics, and I'm going to be some hotshot and raise my hand and be like, but we don't even know the genetics of male factor infertility. And obviously, this person is very intelligent. They're an NIH-funded researcher in this area. And I wait and I listen to the rest of the talk, and they go, and the reason epigenetics are more important than genetics in this standpoint is that we can do something about this, right? These are things that we can intervene on potentially. We can change these DNA signals or these methylation patterns through lifestyle modifications, whether that's being on metformin, or again, we won't get into the finasteride, methylation signals, or stopping smoking or stopping drinking or becoming more active. I think epigenetics are incredibly important in this space. But right now, we're using them more as a marker, and we don't have the interventions we need to be able to actually correct some of these things. So again, living a healthier lifestyle is the one thing we do know does significantly impact some of these methylation patterns.